Good afternoon once again. Today is Wednesday, the 17th of June 2020, and this is the English language summary here at the Daily Press Briefing at CCSA. So we're here for you every Monday, Wednesday, and Friday. We'll be here as long as necessary for your benefit. So first of all, I'll start by giving some good news as mentioned by the spokesperson himself. Yesterday, once again, was the day that we had zero infection in Thailand, which is very good news, and we'll have the numbers for today as well. And on screen coming up, we also have an infographic summarizing the fourth phase of relaxation in English. You can find further details of this infographic and other information from the Public Relations Department Facebook page, PR Thai Government Facebook page for further details. So one piece of important information is that following the information that we provided regarding the entry into the country of foreign residents, permanent residents as well, that we've mentioned on Monday, I'd like to touch upon another piece of information related to this is about the quarantine facility, or the so-called ASQ, the alternative state quarantine, the various hotels that is aimed to cater to the incoming foreign nationals coming into Thailand on a case-by-case basis now and in the future. So these hotels, alternative state quarantine hotels, these available facilities, currently there are around 600 rooms. So that would be catering to the incoming foreign nationals in due course. Now, on Monday, we mentioned about the work permit holders. We're now in the beginning phase of this opening up. So those who wish to return to Thailand may contact the Thai embassy and consulate for that particular request to return. The request will be considered on a case-by-case basis and depending on the necessity. So please inform the embassy of your urgency, state your urgency. This is for foreign nationals of whatever status you have or documents you have in Thailand, be it work permits, be it permanent residence. Please contact the embassy. Please send in your request. The process for documents for those who have residence in Thailand wishing to enter will be similar. The process in submitting documents and the documents will be similar to the documents required for those holding work permits. And as mentioned, please state your urgency. It will be considered on a case-by-case basis. Just please contact the embassy. The rationale for urgency might be for family, for work, and other special cases which I have not mentioned. So this is for the permanent residents as well. I think that this group has been waiting for some information on this. So please contact your embassy. The embassy will be filing the request and information to Bangkok for consideration on a case-by-case basis. Today, we also had Dr. Polawat Witun Kolashit, the Inspector General of the Ministry of Digital Economy and Society, briefing us just now on the Taishana platform. We have statistics that the number of people using Taishana may be decreasing a little bit. So as we are in the fourth phase of relaxation, it means that more establishments reopened, also comes with higher risk of COVID. So the platform continues to be an important tool to prevent the second wave. So we hope that the general public will continue to use Taishana. Dr. Polawat also mentioned about certain business establishments, and the spokesperson also mentioned certain business establishments that did not have the Taishana platform QR code posted in front of their store, but rather they had a list for customers to sign in their names and telephone numbers. That is fine, of course, but the precaution is that these business establishments, stores, and restaurants should not allow for that information to go elsewhere, to be someone to take a photo of the phone numbers or names of the persons, of the customers, for use only for specific purposes, only for the purpose of finding infected persons or those who were in the same venue and time in that store, in that establishment, as the infected person, if so the case. Also, the Inspector General of the Ministry of Digital Economy also mentioned about the use of Taishana, which is available on both Android and iOS. The application of Taishana would be updated in due course very soon to enable users to perform group check-in. Group check-in meaning if you go with friends to a restaurant, one plus three persons can do the group check-in on this application, which would make it easier to use, facilitate the use of the application. And we, of course, we note the concerns on privacy on the Taishana, and please have faith that this platform serves for the purpose of only health and to control the pandemic. Of course, not to track any activities or use the data in terms of aside from the issue of infection of COVID. So your privacy will be ensured. And if there would be a person infected with COVID, those who use the Taishana platform will be notified effectively. Yes, so moving on to the issue of the general situation and number of cases. As I mentioned yesterday, 0. Today, we have good news that it's also 0. No confirmed case reported today. The cumulative remains at 3,135. 95% of that number have already recovered or been discharged. There may be some questions on how Thailand has been coping with the situation quite well. And as we mentioned quite often, the over 1 million village health volunteers deployed throughout the country have been instrumental for that. They've significantly helped enhance the understanding and raise awareness. It's a unique model, simple but yet effective. And as you may have seen in the news, we are promoting for local travel, of course, with the necessary precautions. And one of the schemes is, of course, to have the village health volunteers be able to visit various local sites, because, of course, in the past months, they have been key and instrumental in raising awareness and helping to contain COVID. So this scheme will be sort of like a reward for the village health volunteers. So we thank, of course, everybody in Thailand, foreign nationals as well, and Thai nationals for your cooperation, practicing the new normal lifestyle using the Taishana. And of course, those who return from abroad, be it Thais being repatriated or foreign nationals being allowed in, work permit holders being allowed in on a case-by-case basis. Thank you all for the compliance with the state quarantine system. And this, of course, makes Thailand's capacity to control COVID very effective and long-standing. Long-standing meaning right now we have approximately 23 days already with no domestic local infection, 0 local infection in around 23 days. So as the number of infections continue to be under control, we are reminded that we've been through a lot together, of course. The peak one time, I believe, was as high as 188 persons per day. Of course, we don't want this to happen again. We've come a long way. We're on the right track. So hope for your continued support. The spokesperson also mentioned about the case of Thais in Saudi Arabia and Egypt. You may have heard on the news about Thai nationals infected who resided in those countries. Many of them are students, Thai students as well. So the government still continues, of course, to take care of these Thai nationals. There are flights being prepared for the repatriation of Thai students from Egypt and from Riyadh, Saudi Arabia. And so our embassy in Saudi Arabia and the Consulate General in Jeddah in particular on the 14th of June also organized a video conference between Thai doctors and the Thai nationals in that country to consult about any impending symptoms, and of course to decrease the stress that they may have while they are awaiting for a return, the repatriation flight returning to Thailand. In addition to the video conference, the Consulate General in Jeddah and the embassy in another country, the Thai embassy in Egypt, in Cairo, have also established a social media group contact to be in close touch with the Thai students and Thai nationals in those countries. They established a line group contact group so that these individuals in the two countries will have direct contact with Thai doctors and the officials of the Ministry of Health. As mentioned, of course, there are repatriation flights from various countries and territories around the world ongoing for Thai nationals. And we're doing this in parallel, of course, with the procedure that I mentioned earlier about the entry of foreign nationals holding work permits, and even those with permanent residence. You can contact the Thai embassy to start the process, of course, with urgency, with a rationale, a reasoning why that should be considered, of course. So as we continue this parallel track, we have some images for you for the Thai repatriation and the embassies who are continuing to work around the clock to assist Thai nationals in their repatriation. On screen, we have from the Royal Thai Embassy in New Delhi, India, that on the 15th of June, on Monday, with the Thai community in India, we assisted 189 nationals on their flight back home, and also, of course, on the embassy in another country, in the Royal Thai Embassy in Tokyo, Japan. We also have an image of that. On the 16th of June, which was yesterday, in cooperation with various agencies, facilitated Thai nationals back from Japan. It's worth mentioning, of course, that all of these that we've mentioned every day, those returning, be it Thai nationals or foreign nationals, there are diplomats, foreign diplomats, of course, and work permit holders coming in on a case-by-case basis. All these individuals, it's worth mentioning that they have given consent to being quarantined for 14 days when arriving to Thailand. And of course, consent plus it's compulsory and very necessary to maintain the numbers, the low numbers that we have. It's very important. So for those who are filing for return to Thailand, be it Thai nationals being repatriated or foreign nationals, please, of course, consider this, that you have to give your consent to be quarantined for 14 days. So I have also some additional points in terms of the question and answer. The first is about the travel bubble. When will the travel bubble be available? We received that question, and it's been mentioned by the spokesperson as well in the past days. As of now, this scheme is still being discussed by the authorities. The planning is still being done. However, since the situation has improved and many tourist destinations have reopened, it would be a possibility in the near future. But of course, with many conditions that we have to maintain and keep in place. We encourage, of course, everybody to explore Thailand in due course. But of course, in the meanwhile, maintain social distancing while you travel and comply with all the various measures while you travel. Of course, we don't want to be a killer of joy for anybody, but of course, it's your responsibility as well to maintain and comply with all the measures while you are traveling around the country. That's about travel bubble. There's also a question about why has Thailand not conducted random COVID testing. This question comes from time to time. Thailand has a strong epidemiology team and trained investigation teams to carry out contact tracing and investigate every confirmed case since the very beginning of the outbreak, if you recall. And we use a strategic active case testing method targeted at high-risk close contacts with infected persons. And the rationale for not conducting mass and random testing is because the current data proves that only around 2 to 4% of high-risk close contacts are infected, a very low rate. This implies that the infection rate for low-risk contacts would even be lower. However, therefore, the random testing would not be applicable to Thailand, and authorities are currently carrying out many tests, hundreds of tests for every confirmed positive case, which is already a high ratio for Thailand's situation. Another recurring question is about whether Thailand has been concealing any actual numbers of COVID-infected cases and deaths. So from the data perspective, Thailand's reported low mortality rate and confirmed positive cases were quite convincing in terms of data, because there would have been many more deaths, maybe thousands, if infected cases were underreported, which is not the case. As is happening in some other countries at the moment, there are many, some countries with hundreds and thousands of deaths. But of course, this is not happening in Thailand. And moreover, it would be very difficult to hide, conceal any significant number of deaths if that were the case. So just in terms of conclusion, for Thailand, I'd just like to mention that our key approach has been to promote universal precaution. I use the word universal precaution. That is to assume that everyone is infected, assume only that everyone is infected, and to act accordingly by asking the public, you, all of you, to practice preventive measures such as masks. We mentioned time and time again, quite often, repeating, maybe like a broken record already. But asking the public to wear masks at all times in public spaces, observing personal hygiene, physical distancing, social distancing. Establishments have also been satisfactorily complying with the various measures to prevent COVID. The fact that most of the public has cooperated with authorities was indeed key to the current success in Thailand. So once again, we encourage you to utilize the Taishana platform. No one is able to predict if there would be a second wave. Our responsibilities are to make ourselves, our families, and our communities safe from infection, even till today. We keep that in mind. Therefore, we have to prepare and cope with any challenges coming. We have to adjust ourselves to the new normal lifestyle and keep the second wave away. So thank you very much for your attention, and then we will see you again this Friday. Thank you very much, and สวัสดีครับ